Good afternoon, everybody. I'm going to speak of a man who needs no introduction, but he's going to get one anyway. Sam, obviously the CEO of the comment on dit, la Mission Bon Accueil, or the Welcome Home Mission. I didn't realize that it was founded in 1892, and it's been providing Montreal residents in need with a wide range of services ever since then. They operate an emergency and supportive housing unit. They operate a mental health treatment unit that's affiliated with McGill and the psychiatry department of the Jewish General Hospital. They run a rehabilitation service and a free dental clinic with McGill University's Faculty of Dentistry. I might call you up on that one. And they provide housing and practical support to young mothers and their children. Sam has been an independent team effectiveness consultant in his past, consulting corporations, governments, and not-for-profit organizations. We all know that he's an author of Good Work Done Better, the book that proposes new ways of thinking in the community-based nonprofit sector. He's also authored articles for a diverse number of local and national publications. Some of the boards that he serves on at this point, and I know that this is a short list I'm giving you. He's on the Canadian Alliance to End Homelessness, which I believe is the newest one, if I'm not mistaken. He's on the National Housing Council, which is relatively recent also. And another one that you may not have heard of is L'Arche Canada. And that's an international federation of nonprofit organizations that work together to create networks of community where people with and without intellectual disabilities can live and work together. Having said all that, Sam, as we all know, is the guru of homelessness. And I'm going to let him take the floor from here. It's all yours, Sam.
Thank you, Jim. The introduction to our Rotary family probably isn't necessary, and you know how uncomfortable I am with flowery introductions. I always tell people that I'm a very ordinary guy who gets to do a lot of work with some very extraordinary people. And so it's a privilege for me to serve on the boards where I serve. It's a privilege for me to serve as the leader of Welcome Home Mission. And yes, it was founded in 1892. Yes, it has had a lot of CEOs over the years. And no, I am not the founder. You know, the white hair aside. But the interesting thing about the mission is that it has evolved quite a bit over the number of years, partly because the needs in Montreal have evolved. And so some of what I'm going to share with you today is really about the evolving need as it relates to the reality of homelessness. And it should be noted that I was kind of pressed into service, or I maybe volunteered myself into service. So my preparation for today has been somewhat limited, but I'm going to end up repeating probably some of the things that you might have heard me say in other venues or in the media, or if you read my most recent column in the Montrealer. I have the privilege of having the page 2 column space monthly in the Montrealer. In a moment of weakness, I guess Peter Kent decided that would be a good idea. But I think what I want to start with is really the notion, and this is an outrageous statement, if you will, that I believe that homelessness should not exist in Canada. Homelessness should not exist. And that, you know, sounds like maybe an obvious statement, but to others, they might say, well, wait a second, Sam, aren't you being a little bit pie in the sky? Aren't you having a little bit of wishful thinking with respect to that? But I think we as Canadians have a self-image of ourselves where we would say we should be better than that. We should not be the kind of society that allows our most vulnerable people to languish on the streets. And I sometimes, in presentations that I do to healthcare professionals, I start out by saying, imagine that you're somebody who comes to planet Earth from outer space somewhere. There's another civilization that's been discovered. Boom, they land here, and they happen to land in Canada. That's CBC. So now they land in Canada, and you explain to them that Canada is a wonderful country. In fact, you've landed in one of the better parts of planet Earth because we take care of each other here. We have a variety of services. We have socialized medicine where we take care of everybody and we make sure that everybody can see a doctor. And we're really one of those places where, we democratically elect our officials. And but then the question gets asked, well, what about the most vulnerable people in your society? And we say, oh, wait a second. For those people, we actually allow, or we encourage, a large collection of community organizations who are under-equipped, under-resourced, and in many cases underqualified to look after these people. Oh, and furthermore, these people have to sort of shuffle around from place to place to place to try to find the service that they need. And if they find it, that's good. If they don't find it, well, they come back again tomorrow. To me, there's a disconnect there. If we had lineups outside of hospitals to serve sick kids, we would go, that's a scandal. But we have lineups outside of community organizations to serve people who are poor, hungry, disadvantaged, or homeless. And so there's something that doesn't work. There's something that doesn't connect. And so what I would say to people who want to understand the genesis of homelessness is that it's a problem that developed built on a legacy of a discredited premise. Now, the discredited premise is really a function of the fact that we used to have a single type of problem with people who were experiencing homelessness. If I look back in the archives of the mission, even 40 years or so ago, the problem of homelessness was largely related to men, usually between the ages of 35 and 50, and they drank too much. And so the answer was actually fairly simple. Stop drinking, get a job, go back to your family if you had one, and all will be well. And that answer seemed to suffice for a while because, to some extent, community organizations like ours were a little bit like an organization that kept a pot boiling on the back burner of the stove. Every once in a while, it would boil over a little bit, but then we'd slam the lid back down on it. And everybody would say, oh, those organizations, they do such good work. They take care of the people that sort of fall between the cracks of our social system, and they're doing good work. Well, the problem with that model of care is that it assumes that there's only one challenge, which would be an age demographic and a single problem. Today, what we face in homelessness is a wide age range, a wide series of past experiences, and a number of comorbidities or traumas and situations that are not just one thing. You can have somebody who has had past trauma, suffering from mental illness, and has a crack problem. And that's probably not all. Maybe the person also has mobility issues. So the challenge has become far more complex. And you don't need to go any further than looking at all the stories that you've seen probably in the media recently about what's going on underneath the Ville-Marie Expressway. At the start of that particular little mini crisis, there were 15 people camped out under there. And by the way, they aren't always there 24/7, and none of them have lived there 10 years, even though that's what's in the media reports. Because a lot of times people who are experiencing homelessness just invent a narrative that sounds good, and we need to dig beyond the narrative. But part of the problem with that group of people was not so much that they didn't want to be housed. I mean, sure, the reporters found the one person out of the 15 who would go on camera and say he didn't want to be housed. The other 14 were all quite agreeable to be housed. The challenge was that we don't have the resources, the systems, or the solutions easily at hand to resolve complex cases. And the ones under the Ville-Marie, trust me, it's complex. Our psychiatrist that works with us, he's affiliated with the Jewish General Hospital. He's gone under there twice to talk to people, and he comes back every single time shrugging his shoulders and saying, Sam, I've never seen anything like this. And this is a guy who works all day, every day with people experiencing homelessness who have some pretty complex challenges in the area of mental health. So we built this legacy system on a premise that's no longer accurate. To accurately assess what we're dealing with, we actually need to see homelessness not as a homelessness problem, but as a complex healthcare problem. And if we're able to reframe it that way, if we're able to look at it and say, this is really about healthcare, and it's about how do we treat the most vulnerable people in our society. If those are our two anchor points, then we come to a very different conclusion than we typically have come to. And it's very different from the one that we used to come to 40 years ago. I think the other thing is that we've got a reasonably effective service model at a number of levels, but there's a number of missing pieces. And so here's what I proposed in my most recent article in the Montrealer, which some of you have probably read, is I said the solution to homelessness is actually simple, but it's not easy. It's simple because there's three things we need to do. It's not easy because it's going to involve all levels of government and a number of other players around the table who are all going to have to be singing from the same song sheet. The three things that we need to do, very simply put, and I'll try to explain each one of them, are prevention, efficiency within the ecosystem, and multiple pathways of exit. So prevention, efficiency, multiple pathways of exit. Prevention, first of all, and this I think is probably fairly obvious to everyone on this call, it's far easier and far more effective to prevent somebody from falling into homelessness than it is to deal with them once they're there. The cost of emergency services, the cost of rehousing somebody is significant. And so if we can put measures in place, and we know how to do it, we've done it, we're doing it, we're just not doing enough of it. But if we can do that, then we can prevent the kind of inflow that we're seeing right now. There's a new wave of homelessness that's cascading across the Canadian landscape right now, coming out of the pandemic, and it's got a complexity like we've never seen before. And so one of the things that we have to do is we have to work harder in prevention. There are a number of places that we know that we can go to in order to take actions that will prevent people from ending up in the emergency services system. So it's a little bit like any kind of manufacturing business. If you've got too much inflow and not enough outflow, things clog up in the middle. Well, so when it comes to the middle, which is my second point, we need to get much more efficient and effective in the middle of our system. Right now, somebody who experiences homelessness can wander round and round and round without ever getting the answer they need, in part because of the nature of the challenge of homelessness and the nature of the people who typically fall into it. We need to develop a system that we typically throw around the words coordinated access. And what that means is that somebody who knocks on a door should never knock on the wrong door. So our system needs to be oriented in a way that there is no such thing as a wrong door. When somebody shows up at somebody's door, they can be immediately met with, understood, listened to, triaged, and directed to the right kind of service for them at that moment in time. And it's as simple as the principles that we find in emergency rooms in our hospitals. That's precisely what happens when you show up in an emergency room is, you don't get to wander from emergency room to emergency room. In fact, if you show up at a second one tomorrow, having been at another one today, they will know you've been there. So the system is set up such that there is an ability to track who goes where and when they go there and what the challenges are that they identify. And so within our system, within our existing system, I often get the question from reporters, Sam, how many emergency beds are there in Montreal? As if somehow this is the answer to the problem. My response is always the same. I always respond by saying, you've just asked me the wrong question. The right question should be, Sam, if someone falls into homelessness today, how quickly can that person expect to be able to exit from homelessness? So the issue is about speed of exit, not the number of emergency beds. We would like to see, people like Old Brewery, Maison Super, and ourselves, we would like to see fewer emergency beds exist in Montreal because we increase our speed. If we can turn over our emergency beds 5, 6, 7, 8 times during the course of the year, and by virtue of housing people, then we'd be able to deal with the inflow that exists right now. But as it stands right now, our turnover rate is something around 2, maybe 3. If I look at Hotel Dieu, for example, 186 people there on 24/7. We've housed around 90, maybe 100 in the last 6 months. So, that's been pretty good, but at the same time, it's certainly not turning over at a rate of 7 or 8. The third thing that we need, which maybe you kind of caught me alluding to it in the beginning, is because the challenges of homelessness are far more complex than they ever used to be. We need more avenues of exit, more solutions, different solutions. The needs of a 24-year-old woman with a young child are very different from the needs of a 52-year-old man who's worked all his life, but has had a couple of reversals and finds himself on the street, or the needs of a 45-year-old individual who has multiple addictions. So we need to be able to adjust the solution to meet the needs of the person. And when it comes to mental health challenges, I often get this sort of thrown back at me by concerned individuals. They say, well, Sam, isn't homelessness really about mental health? And I have to say, yes. I mean, if you look at the people underneath the Ville Marie, 13 out of 15 of them have severe mental health challenges. It's not unusual. Pick your percentage, but somewhere between 30 and 50% of men that are on the street experiencing homelessness have some form of mental health challenge. When it comes to women, it's over 80%. There's reasons for that. But it's not because women are different, by the way, but it's a longer discussion to get into why that's the case. The reality is that, we don't step back and say, well, it's too bad about George. He's experiencing homelessness because he's a diabetic or because he's got cancer. But often our mental framing is to say, oh, well, mental illness, of course. Well, that's why he's experiencing homelessness. I think we in 2023 are better than that. I think we understand that mental health challenges are mental health challenges, and they need to be seen as part of the continuum of healthcare challenges. And these are the kinds of things that can be addressed. They can be addressed with solutions. A very good illustration is our mental health program that we have in the Macaulay Pavilion at Welcome Hall Mission. It only has 8 beds, but since its inception about 3.5 years ago, we've managed to house 100 people permanently with a lease, with psychosocial follow-up orchestrated by the hospital system, seeing mental health professionals on a regular basis. These were people who used to wander in circles in our parking lot. They usually were no trouble, but they were also extremely chronic. And everybody would say, well, we just can't solve that problem. Well, we actually can. If we bring the treatment of the hospitals into the community, which is what we've done with this particular program. And the program has been so innovative that it's actually been written up in 2 different American scientific journals. So it's kind of cool to have that happen. I can wave those articles around and feel good about them, even though it's got nothing to do with me. It's our team. But those are the kinds of things that we need. So ultimately, I think what we need, and with this I'll conclude and hopefully get a few questions from you folks. I think we need to move the policy needle and the policy making decisions at all levels of government. It's going to take policy initiatives out of the feds, out of the province, out of our municipalities in order to actually resolve the challenges that face us. And they're going to have to coordinate and act together. The other thing is I think we're going to need to move the needle of public opinion. Policy tends to move very slowly unless there's compelling public opinion. And one of the things that I know I'll be working on with the Canadian Alliance and with the National Housing Council is to shift that perception, that public opinion continuum, if you will, so that rather than looking at these people as a problem, that we start to look at our fellow citizens who are experiencing homelessness as people that we need to serve, and we need to serve them better. Now, the good news here for Canada is we are not the United States. I've been to the United States. I've walked the streets of most major most major American cities, large and small. I think we don't want to get there. I don't think we want to be like them. And so the question that I often get is, Sam, hang on a minute. What's this going to cost? My usual response, unless I've got tons of time to start spelling it out and show you spreadsheets, is what will it cost if we do nothing? What will it cost if we do nothing? The human cost and the economic cost. Take a look at what's going on in places like Seattle, San Francisco, Los Angeles, New York, Indianapolis. I can keep naming cities. There's been some progress in a place like Houston. That's worth reading about, but it's interesting to see. And so on that note, I'll kind of close, because I think if we move the needle of policy making and we move the needle of public opinion, things really, truly can change. And taking it right down to where we are right now, most of us are sitting in Montreal. The challenge in Montreal is actually less of a challenge numerically than what we find in many other cities, and even per capita. I mean, the problem in a place like Halifax, numerically smaller, but per capita greater. Same thing in Winnipeg, same thing in Ottawa. And of course, the Vancouver downtown east side, you all know about that already. And all you need to do is walk up Yonge Street in Toronto, and you'll walk back shaking your head. So we in Montreal have a history of being able to tackle many of the complex social challenges slightly better in many cases than the rest of Canada. And so I'm trying to speak to our decision makers to ensure that we continue to do that. And on that note, I'll thank you for listening to me patiently and my rant, and invite any questions that you have, which Jim, you can facilitate.
My pleasure. I'm going to start off with one. In my mind, you only need two things. You need money and you need the political will. Assume, just for argument's sake, that the money is not an issue. What's the matter with the political will? Or is it the money that matters?
Well, and interestingly enough, it may not be a lot of money. Right now, there's an inordinate amount of money being spent on emergency services. What would happen if we did our prevention right and we did our housing piece right, and we could shrink the amount of money we spend on emergency services? So it's if we can make the moves right now, yeah, it's going to take some initial investment to get there. But if we make those moves right now, I think it might not be a question of a huge amount of money. The political will piece, though, is a little bit more complicated, because governments tend to move based on what they think the voters believe. And people who are vulnerable tend not to vote. And there's not very many of them. Even though the numbers are growing, it's not a significant electoral block. When was the last time you saw a whole group of people experiencing homelessness marching on Quebec City? Doesn't happen, but try to cut the salaries of name your sector and you'll get a march on Quebec City. So that's a challenge. And the other challenge, of course, is one of the different levels of government. The feds, the province, the municipality. The feds have an overarching role to play and monetary role. The money flows through to provinces. Provinces then have to prioritize. And so you have to make sure that the priorities are the right ones. But then when it comes to housing specifically, if you want to talk about homelessness and housing, municipalities have a lot to say. And so we've recently had experience where 2 or 3 projects that got to the birthing stage were struggling to get approvals inside municipalities. And, there's a factor of not wanting things in my backyard. There's a factor of zoning. There's a factor of everybody trying to take their little piece of the pie of taxation, which raises the cost of building someplace. And it's interesting, the Canadian Mortgage and Housing Corporation has estimated that Canada is going to need to build somewhere around 1.5 million rental units in the next 10 years in order to address the demand that's coming. There's no way that governments can orchestrate that kind of building. It's going to take the private sector as well. So we need to bring the private sector around the table and incentivize them to do the things that we need done, so they're not just building expensive condos.
Part two of the question then, again, assuming that the money is there and assuming that we could build all those houses, would that solve the problem?
Well, you got to go back to my premise, if I'm right, which is that we need to do our work in prevention. So let's start by ensuring that people who are housed today don't fall into homelessness. And to me, that takes a variety of different efforts. And there's a number of obvious points. Incarceration. When people exit from incarceration, we know, generally speaking, what the date of their release is going to be from prison. But if we also know that they don't have a place to go, then all we're doing is we're releasing somebody into homelessness. The same thing goes for young people aging out of care, if they're in foster care. Now, some steps have been taken in Quebec to deal with that, but it used to be that at age 18 plus 1 day, you got a bus ticket. And we know that that was a creator of homelessness as well. So we can address some of those points as well. The other thing that we know about is people who come into our free grocery store. These are people who struggle to pay the rent at the end of the month. Well, if we can take some steps that will actually prevent them from losing their apartments, then we'll also be solving the problem. So if we start with the prevention piece, which is what I advocate strongly for, I think the building of housing pieces, the part where we need to build houses and we need to incentivize, will also be lower, because we'll be keeping people in housing rather than letting them fall out of it.
Okay. Questions, everybody? Jennifer, go ahead. Unmute yourself first.
Sorry, I didn't know if that could be magically done. Hi, Sam. My name is Jennifer Ball. And first of all, I want to congratulate you for the incredible work that you've been doing. I've had the privilege of being able to volunteer for Logifem and for Chez Doris and also for Resilience over the last year. And I know that it's work that's really needed. You talked earlier about, and I also have a two-part question, so sorry, everyone, but you talked earlier about the fact that we need low-cost housing. And we're in a situation right now where a lot of developers are actually avoiding at all costs to develop low-cost housing. There was a perfect example right on our doorstep of Westmount, where the HRM developer, Philip Currib, actually paid a $6 million fine or fee, rather penalty, to opt out of social housing. So that seems to be a barrier. Would you agree?
Yes. and you know, this is the kind of thing that we actually can solve, but it's going to take the cooperation of the province and the municipality to do that. Because right now the municipality is saying, well, how are we going to get our money to be able to put our infrastructure in? And the province is saying, well, you guys should solve your own problems. And so there is right now one of the realities here on the island of Montreal is politically the folks in Quebec City don't have any particular political reason to dance with us. And so, you know, I've had to work kind of behind the scenes with people to convince them to do certain things. But I think that is one of the challenges. We need to get rid of this ability to opt out of, you know, to pay a $6 million fee. But the other thing too is we need to take a look creatively at, is the right approach to is it the right approach to build, to try to force builders to build something that doesn't always work inside a building plan for that builder. And I think that is an open question as well, because ultimately these folks will build whatever we incentivize them to build. And right now, the incentive is simply not there. I've sat with very sympathetic builders who show me that on a cost basis, on a spreadsheet, look, Sam, I can't do anything. I can't. One guy was showing me how the lowest rent he could charge for a building with bare bones would be $1,500 a month. That's not really affordable. And we've lost 85,000 units of affordable housing in Montreal in the last 3 years. So not that they've disappeared, they've just gone up in price.
Exactly.
So yes, to your first question.
The part two was last year there was a census taken for homelessness in Montreal and Westmount. And I realized that the data may be a little bit skewed because it's completely voluntary, but has, to your knowledge, that data been published? And would the indicators be, which is if it has been published, would the indicators be that the problem is growing of homelessness in our area?
Yeah, first of all, it hasn't been published, which is interesting because I'm on the pilot, the comité de pilotage, so I will know before anybody else does. But it's in the hands of the politicians. So the timing of the information will be political. And, we don't have any control over that. My suspicion is we'll see the data point going up. But the thing to recognize about this point in time count is it has some rather strict limitations to it. It is like taking a snapshot, a Polaroid on any one given night of the situation. And it's subject to a variety of limitations that you pointed out, like finding the people.
Right.
There's a certain element of the number that we will be absolutely confident in, because the number last time in 2018 was 3,149 people. We're absolutely confident of about 2,300 and some odd in that number because we know where they were. And the definition of homelessness is no permanent address. So even people living in transition places or at Logifam or places like that would be counted in. The number that's harder is the number of people who are on the street and unsheltered. And that's a bit of a guess because some people you run into, I was out there on the street counting, and me with the person who was with me, I think we filled in 8 or 10 forms, and we were operating near the Beaudry Street metro station. So we were right in ground zero. But a point in time count is very limited. And one of the tools that we need, because I mentioned my point number 2, is more efficiency inside our ecosystem. We need more real-time information inside our existing ecosystem so that we know what's truly going on. Organizations like ours and Old Brewery, Maison Super, and a number of others, we can share certain amounts of data right now, but the system itself is limited. So we're looking to try to build that out so that we have a better handle of what went on last night, rather than relying on a point in time count that happened a year or 2 ago.
Understood. Thank you.
Because it tends to falsify things for the media too. Because I always get media people who throw the 3,149 number at me as if that's some sort of magical thing that I should know about. And realistically, it was just a snapshot at a point in time. It's, it's a little bit like talking about what the waves in the ocean were like a year ago.
Exactly. But I think overall applications, that's another data point that is really important. I think applications for residents and for shelters I think it has really kind of escalated since COVID even.
Yes.
Questions, queries, comments?
I think I saw Bill.
Bill, go ahead. Just unmute yourself there.
Hey, Sam, thank you very much for your discussion. It's certainly a moment of reflection in of itself, your discussion of homelessness. My question, I've got actually a number of questions, but the first one is when and why did you join the mission?
The short version of the story.
Yeah.
I was contacted by a headhunter who said, you know, we need a new CEO of Welcome Home Mission. It's a big organization, so they had a long list of things you needed to have done or be. And I initially said, no, thanks very much. I love what I'm doing. But they kept on talking to me, and I made the mistake of going and talking to them. And then it became one of those decisions that I guess I had been relatively successful in my business career and felt that maybe this was time to take what I'd learned and see if I couldn't do something with all of that. Little did I know that, you know, as time would go by, that this would be one of those things where it was a great learning experience for me as well. So as much as I thought I might be giving back, you know, you've probably had this experience too. When you're giving back, you actually get. And so I think that's kind of my story. The funnier part of my story was when I went and told my wife that I'd said no to the headhunter. She asked me, well, if the Montreal Canadiens had invited you to come and be their general manager, what would your answer be? And I'd say, well, my answer would be, I don't know anything about hockey, but I'd certainly like to sit down and talk to you about it. And so her response was, well, then go and talk to the people at Welcome Home Mission, which is what I did. So it's an iconic organization that has a unique sort of DNA inside the place, that people are looking for solutions, and they're innovative, they're creative, they're passionate, but they're also very competent. And I'm lucky enough to be surrounded by a fantastic team of people who deliver the merchandise. So it frees me up to do a lot of the outside initiatives that I'm privileged to do. You're still muted, Bill.
Unmute. When did you join, and what is your staffing level?
I joined in 2016.
Okay.
And we have 220 full-time staff.
Wow.
Full-time meaning 40 hours a week, and about 400 volunteers that are involved in the mission. The two free grocery stores that we run are the place where most of those volunteers will be serving. The face-to-face with people experiencing homelessness or in our various services, that's largely with professional staff.
Thank you.
Mr. Gould, you're next up. Unmute yourself.
Mute here. I enjoyed your presentation, Sam. That was very interesting. Just a couple things I've been involved with. We talked about developers. I was with the Tridel organization in Toronto for many years, and their seniors housing area. So I know I've been in meetings. We're trying to crunch numbers to get low-cost housing involved in large condo projects, and you know, you're right. It doesn't work very well. But a couple of things I just wanted to add. One of the things that I know that Tridel is involved with, there's a nonprofit organization in Toronto called Options for Homes, where the organization buys secondary land along railroad tracks, bordering industrial areas, whatever. And the developers, including Tridel or other developers, will build condos, but they're very basic condos. They don't have the big party rooms. They don't have the swimming pools. But what it does is enables people that have lower incomes to be able to get in with subsidies to get in to become homeowners. And they're able to buy into these condos, which are nice condos built by reputable builders, but they don't have all the bells and whistles that the higher profile ones do. So those projects for the people that do have some resources work well. The other thing I saw on CBC a couple of weeks ago about a project in Waterloo, and it was something that was referring to, I think it was called New Tent City, or it was a reference to what they had developed was these small modular homes, like 10 by 10, and for homeless people. So people have their own space, they have a bed, they have a little counter. But I guess the selling point there was that you don't need a building permit, apparently, to build if it doesn't have a washroom, there's no plumbing. So it's almost like a campground. There would be communal some communal washroom showers. They had people volunteers that would come and check on them. But basically they had a 10 by 10 room with air conditioning, electricity, and a bed, but they had a door they could lock. The people they interviewed said, being on the street for years, to actually have a place where they can go in and have their stuff safe and to be able to lock the door. And then they had volunteers that would check on them, maybe take them to dental appointments. They even had injection sites if the people needed it, but they were able to build them on more industrial land because they didn't need a residential lot and they didn't need building permits. So that was there was a couple of those projects down in the Waterloo area that's kind of interesting. But yeah, so like I say, there are options that people are working on out there.
Yeah, and my comment to you on both of those initiatives would say that to me is part of that multiple pathways of exit that I can foresee. I'm less inclined to like what I would call ghettos of formerly homeless folks. So we have to be careful about setting up something that is nothing more than an elevated encampment. Realistically, Canada has passed the right to housing legislation. We should, and part of the job that I have at the National Housing Council is to hold the minister's feet to the fire on the human right to housing, which is in law in Canada. We're just not there yet. We know we're not there, but we've got to get there. So there are ways, I think, of doing slightly better than the Waterloo situation. I understand what they're doing there because it's a patch on a patch that's solving another problem. And it's certainly better than leaving people in tents around Waterloo. But as a permanent solution, I think that your condo idea is far better if it can be pulled off. And that's where it does take all levels of government. It takes the province or the owner of the land to say, we're going to be able to make this available. It takes the municipality to do the zoning things that are necessary and to navigate the potential for a referendum to be held in the neighborhood that votes down the project, which is what we see quite a bit. And so I think that those are a couple of the many solutions that are out there. What we typically prefer to do is try to reintegrate someone into the community in the location of their preference. So if someone wants to live in borough X, we don't try to put them in borough Y because they're not going to like it. And so we try to find a place that's in a location where they're going to thrive and then reconnect them to a bunch of services. And so the success of rehousing somebody, particularly if they've experienced a certain amount of chronicity, is really directly correlated with the reconnection that can be established. If someone is sitting in an apartment or any kind of dwelling, staring at four walls all day, in many cases, they end up back on the street. And so we've got to develop that active reconnection. And when that happens, it can be magical. And not that it's easy, but at the same time, it's essential that we do that.
But there's certainly a lot of government-owned land that is centrally located in cities across the country. That,
and the government has to be ready to part with it.
Yeah, I know there was discussions in Toronto about the Downsview site, which is about 125 acres right in the middle of the city, where that they could take a portion of that and use it for community housing. But that was, again, it's always a challenge because the government's trying to get money out of it as well. So.
Yeah, and here in Montreal, we've got the Blue Bonnet site that's been sitting vacant for 10 years, and you could probably build 40,000 doors there, and nobody's been moving on it for a variety of reasons that can be explained, but at the same time, it's just 10 years of inaction.
I spent several months in Victoria in the wintertime, and it's amazing the 10 cities that have sprung up there. And what it's doing is it's really impacting the seniors who always loved living downtown, down near the Inner Harbor, are now reticent to move down there, to live down there, because there's 10 cities close by and Beacon Hill Park and other areas that just the amount of homelessness that has erupted just in the last couple of years in that downtown core.
You two need to get together on a separate phone call sometime, I think.
Yeah.
Yeah, I walked Pandora Street about 3 weeks ago, so it.
Yeah.
But
I'm gonna
I think
move us
Deborah has a
along here.
question.
George, I know that you have your hand up, but I'm gonna go to Deborah first.
Thank you, Sam, for your wonderful enlightening talk to us today. You mentioned that homelessness is really not a homelessness problem, but a healthcare problem, that 50% of men and up to 80% of women have mental health issues. And you also mentioned that you don't see homeless people walking on Quebec City to discuss the problem of homelessness. So my question to you is, if we changed, perhaps we moved the thinking from homelessness to a healthcare issue, could we, and because the people, the Canadians are, the issue of healthcare is so uppermost in their mind at this time, and we have the governments with the transfer payments, and from the federal government to the provinces based on the population, and Quebec being 22% of the Canadian population. Would we get more willingness from the general population to look at homelessness as a healthcare issue? And would it bring more willingness on the part of the Canadian people to deal with homelessness if it were looked at more as a healthcare issue, rather than, oh, these people are just drinking too much, or they're bums, or they don't have jobs, why don't they just get out there and get a job and get out of their tents? If it were looked at more as a healthcare issue, could we shift the dynamics of it? And could we push the governments to give us more money to deal with the healthcare issue that causes the homelessness in the first place?
For sure. And I think that's part of what we're going to be trying to do. There's a couple of major drivers. One of the realities in most Canadian cities, not so much in Montreal, although it's very visible in Montreal, is the migration of people out of Indigenous communities into our cities. And as a result, the visible homelessness that we see has a disproportionate element of indigeneity to it. In Winnipeg, for example, greater than 50% of the people who are identified as homeless are also Indigenous. And so in addition to casting this as a healthcare issue, we also need to look at this through the lens of reconciliation with Indigenous communities, because in many cases, we need better services in their communities, and we also need better services for them when they migrate to our cities. And if we can do that, again, I'm back to, if we don't spend now, if we don't invest now, maybe is the better word, then down in the future, the cost is going to be so much more significant. And we're going to be dealing with a much larger human component, because we need to look at this as a human dignity issue. But even if you choose not to, there's an economic argument to be made, which is we're better off to help people get into housing and keep them there and give them a subsidy to stay there than we are to pay for the services that we're paying for when they end up on the street. Studies over and over again have proven that.
Would people be more willing to be donors, for instance, financial donors, if they were looking at it from a healthcare issue as opposed to a homeless issue, for instance?
Yeah, perhaps. And yet at the same time, one of the pushback things that we get is to say, well, hang on a second, you're asking me to donate. Shouldn't healthcare be provided by our government? So there's this tension that exists about how much government service should be delivered to people in need versus organizations like ours who, 65% of the monies that we take in are monies from donors. not from the government.
But would the
And
voters
so-
get on, would the voters get onto the government more if it were considered a healthcare issue as opposed to a homeless issue?
Well, I think if it continues to be as visible as it is, I already see it getting onto the radar of governments. If I rewind the tape back to when I first got started in this segment in 2016, if it was number 42 on a list of priorities at the government level, that was good. And every once in a while, it would pop up a little higher. In the last 3 elections that I've seen, federal, provincial, and municipal, it was on the agenda in Toronto right now. It's one of the top 3 issues that are being talked about by the candidates for mayor there. So, but there's also a populist wind that is blowing in Canada, coming from the south, that basically says something like this: the last 10 years, we poured a ton of money into trying to solve this, and look, it's only gotten worse. And so let's bring in the police and the bulldozers, and that'll fix it. Let's institutionalize people. Let's force people into treatment. And I don't see that as being the best answer. In fact, I see it as being the worst answer. So we need to protect and be aware that that particular kind of wind is blowing out there. And it's one of those things that has resulted out of the fact of the increase of visibility and the fact that homelessness used to be confined to certain less than desirable areas of our cities, but now it's migrated out into the nice areas of our cities. And a lot of very nice people are saying, I don't want this next to me. My kids are going to play in the park and they're finding syringes. And I get that part.
I'm going to cut in here if I may.
So.
Sorry to interrupt, but I know Vivian is standing in line with there's 2 others after that. I don't know if we're going to get to Glenn and George or not, but Vivian, I'd like you to ask your question, and we'll try to make this as quick as possible. Don't forget to unmute yourself.
Okay, sorry. It's not really a question, but when you said that you have 100 people were sent to homes, I mean to apartments in the past, recent past, I want to ask you, who should I call? Because I am getting so much furniture, donation of furniture and household items. I don't know who to give them to.
Well, the one organization that we contact about that is something called the Welcome Collective.
I know them.
And so that's sort of our go-to. When we house people, we house them with a whole kit of things that is very standardized. So we don't use any used furniture or anything that we collect, partly because the numbers that we're doing, which is 1 every other day or so, we need to have something that, we know that we take this and we put it over there, and that all goes to the person. When they move into an apartment, they get everything from their groceries to their cutlery. That's how we do it. So we don't use any of the things that are out there. And unfortunately, there is a lot of sort of used furniture that exists in the marketplace and that people want to give away, and that's noble. But in a lot of cases, it's not something that can be reused for people who are coming out of a situation where they were homeless and we're moving them into a particular type of apartment. So that's been the challenge with that side of things. And it's just, we have to be really effective and efficient when we're doing it. And that's why we do it the way we do.
Okay, thank you.
Thank you. I'm not quite sure how to handle this, but if as people drop out because we're running late, I'm going to give George one quick shot here. Okay, George, you can unmute yourself, and then Glenn, but it's got to be like 1 minute each.
I listened to your discussion. I have done some work with the Oberoi mission, both my wife and I. But anyway, I bring to your attention, all the governments are looking for people that have money to build low-cost housing. And the Quebec government comes out with a change in how tenants and landlords have to be treated. And some of the things they're suggesting are going to be absolutely against anybody wanting to invest money in real estate. I've been in real estate. I've had tenants who are reasonable people come to me, and they're now in their 15th year, but they're leaving and they're saying, you know, I've been paying rent here for 15 years. That apartment should be mine. I said, yeah, I know you have been paying rent for 15 years, but you didn't take care of all the expenses that go into having that apartment, the general space that's provided, that, and people investing want to make a profit. That's not wrong. But now I think one of the problems there is the Quebec government do not have enough people. So if you're a landlord wanting to go there, or a tenant that wants to take a landlord, right now we're being told you're going to wait for 2 or 3 years before your case will be heard. So it sets up abuse that the people, look what happened in Toronto, where the landlord just lost it at the end. Apparently the story there, that those people abused that apartment. He's now trying to get them out so he could clean it up and rent it. And they're refusing to go. And so he lost his mind, got a gun and shot them. I mean, that's what's happening. But the government could help by having more judges and getting these cases listened to much quicker. And that's part of the problem.
George, I'm going to cut you there if you don't mind.
That's fine. That's fine. Thank you.
And we're going to go to Glenn, please.
Sam, I just wanted to thank you for raising the whole notion of the cost of poverty. The fact that dealing with poverty and homelessness is not an expense, it's ultimately an investment, that it costs more in all the ancillary social problems to ignore the problem than it does to solve it. And when I was working with the National Council of Welfare, we kept trying to make that point to the government. It doesn't seem to get through, but it strikes me as socially and economically so obvious. And thanks so much for flagging that critical point today.
Yeah, thank you. It's a key point, and I think it's starting to be heard maybe a little better than it was a few years ago. And so I'm an optimist. I actually think we can do it here in Canada. But it's going to take all of us, and that's the key message that I want to leave you with. Is it's going to take donors, it's going to take the general public, it's going to take builders, it's going to take landowners, it's going to take landlords and tenants, it's going to take different levels of government and different departments. But assuming we can get on the same page and we can agree that this is a complex social problem that we don't need to have, the solutions are obvious. We don't need any more studies. We know what the answers are, and we can implement those answers. There's some on-the-ground organizations that can do the work. We're ready to shoulder the task. All we need is the tools to get the task done. So on that note, I turn it back over to you, Monsieur le Président.
Merci beaucoup, mon ami. Delightful. I don't know if delightful is the right word, but certainly a very interesting and provocative day that we've had. You and I have had some conversations previous about this kind of stuff. And I'll simply close by saying that I think the sector is very, very fortunate to have you and other people like you working in it now. You see hope at the end, you see some light at the end of the tunnel. And it's good to see somebody and to know somebody who at least has the ear to a certain degree of the politicians and the people that know better or should know better. So thank you very much for so quickly taking on this challenge and speaking to us today. I really appreciate it.